Welcome to the NIHR Dementia Researcher podcast, brought to you by dementiaresearcher.nihr.ac.uk in association with Alzheimer's Research UK and Alzheimer's Society, supporting early career dementia researchers across the world.
Hello, and thank you for tuning in to the Dementia Researcher podcast on location from the Alzheimer's Association International Conference in San Diego. I'm Sarah Gregory, and today I'm guest hosting the first of 4 shows being recorded each day at the conference, sharing highlights with 3 fantastic guests each day. So today is all about the pre-conference and day 1. But before we start, let's make some introductions. So for those who don't know me, I'm a part-time PhD student and a research fellow at the University of Edinburgh. My research is in the field of dementia prevention, with my PhD focusing on stress and my research fellow work focusing on diet as potentially important risk factors for brain health. This is my 4th time to the AAIC conference in person, 6th if we include the last 2 years of virtual, and I've always had a great time, so I'm really excited to be hosting today for the first time and hearing about our guests' highlights of the last 2 days. But that's enough about me. I'm delighted to introduce the wonderful Dr. Lillian Hung, the amazing Dr. Ríona McArdle, and the incredible Dr. Sarah-Naomi James. Hi everyone. So Lillian, why don't you go first and tell us about yourself?
Wow, it's really fun time to be here with you all. Yeah, I am Lillian, assistant professor in the School of Nursing at UBC, University of British Columbia in Canada. And my research looks at technology and a lot of implementations, how we could use technology to support dementia care, mostly in long-term care and hospital. I have a lab. In the lab, we have a lot of fun. So I bring a team of some of the young researchers here as well that in the program. The lab, we have a lot of patient partners. We do co-research. So it's a lot of fun.
Amazing. That sounds so interesting. And I think you're going to tell us a little bit about the technology day as well later.
Yes, it was a great day, yeah.
Brilliant. And Ríona, you've been on the podcast a few times. What's new?
Yes, so my name is Ríona McArdle. I am an NIHR Advanced Fellow now, which is a bit different than the last time I did this podcast. And my research really focuses on improving diagnosis and care of people living with dementia through novel applications of digital mobility assessment. So I work quite a lot with technology, similarly to Lillian, and was also at the Tech Day. And I'm also really, really interested in co-design and working and partnering with patients as well to create my research.
Amazing, thank you. So we've got some really interesting similar themes coming through. And Sarah, it's your first time on the podcast. Can you introduce yourself?
Yeah, it's great to be here. So I listen, but I haven't been on it before, so this is exciting. So I'm a research fellow at UCL, funded by Alzheimer's Research UK, and my research looks at risk and protective factors on brain health, particularly earlier and in midlife as well. So I've been to a couple of pre-conference workshops here, which were around kind of more of the risk factor side, so I've got some interesting insights to share there.
Amazing, thanks everyone. And so I think you probably all arrived before me if you went to the pre-conferences. So when did you all get here? Are we all over the jet lag? Have you been able to do any sightseeing yet?
I'm not over the PTSD of travelling, I have to say. But I have been on a boat to Coronado Island. That's been quite nice, where Marilyn Monroe shot a film, so that was quite good. That was my sightseeing experience.
Amazing. How about you guys?
So I actually had quite a good experience. I feel quite lucky compared to everybody else. And for jet lag, so I've got a 1-year-old son, so I've just come back from maternity leave. And so actually I feel like I've been good, like training for ages to sleep when I can. So actually I'm not too jet lagged. I'm just able to sleep pretty well.
Amazing. So you're just having a great time sleeping.
I have such a good time. I'm learning, I'm sleeping, yeah.
Great. And how about you, Lillian? When did you arrive?
Because I'm not too far from Canada, so it was quite smooth, and I came Friday, and we had a lot of fun because we had the team came together, and we are a bit of foodie, so we have been eating Mexican food. We went to the Lido, Italian food, and it was just the food that we had yesterday was just fantastic. Yeah, the coconut margarita, I recommend it.
Oh, amazing. I feel like I need to go out and get some sightseeing done, because I arrived late on Saturday night, so I haven't been able to do much yet, but tonight onwards I'll be able to explore. So and have any of you been presenting at the conference yet? I think some of you have presented or maybe all of you have presented at the PIA Days, maybe? Should we go Lillian first? Do you want to say what you've been presenting?
Yeah, so we have a few projects. So because we brought the team, we presented posters. We presented a telepresence robot project that we use in long-term care to support people to do virtual care. And we also presented a talkie, which is a smart audio device that people use during the COVID outbreak for their family to stay connected with their loved ones in long-term care. Yeah, it was a lot of fun. Yeah.
And have you got kind of junior researchers from your group being able to present here as well?
Yeah, so we also had other students that they presented. Actually, they presented a virtual format, and they had those TVs in the exhibition hall. So it was kind of, for us, it was like hybrid, because there were some of the students went in person and then introduced some of the people on hybrid. And we also have some poster today as well that we present. The Overcoming Loneliness project that we used the telepresence robot to do interview with the residents in long-term care home, because we were not able to get in. So we had some of the older people that being the interviewer and the peer support person, and interview the residents in the long-term care home. So that's today. Yeah.
Amazing. Busy time for your lab. And Sarah-Naomi, what have you been presenting or will be presenting?
Sure. So I presented at the Reserve and Resilience PIA Day on Saturday. And so I have been doing some work looking at some factors in the life, like things like education, social class, childhood cognitive ability, and how that can kind of buffer the effects or the cognitive expression of certain pathology. So this is quite an active area of research, and it's been great to kind of work with other collaborators across the world on this. I think what is novel about what we were showing is that we're doing it in a sample of 70-year-olds, so they're still not really showing severe signs of dementia. So we're seeing in a fairly cognitively normal sample that you can buffer the effects of things like amyloid, hippocampal volume, due to some of these kind of things that you can do in your life.
Amazing. And Ree, what have you been presenting?
Yeah, so I was presenting a poster at the Tech Day, and I'm presenting on the same topic on tomorrow, on the virtual dementia care session. So I was looking at the effects of local area deprivation on physical activity participation in people with dementia. So we were essentially kind of interested in, why do people stay physically active with dementia, or why do they lose their physical activity? And most of the research has kind of looked at cognition or disease-related factors like movement problems. And people haven't really thought about those socio-ecological factors, like how does the environment someone lives in dictate if they can be physically active. But interestingly, we actually found that the more deprived areas that people live in, if you're an older adult without dementia, that means that you are less physically active. The better, the less deprived areas that someone lives in, then you're more physically active. But for people with dementia, there was no difference across those deprivation levels. So it's nearly like the cognitive impairment itself might be a barrier, or maybe all the other things that come with cognitive impairment, like carers might be worried about you leaving the house. You might be worried about getting lost if you leave the house. Those kind of things probably have a big impact on your physical activity. So it was a really interesting piece of work that I did with Dr. Callum Hamilton at Newcastle University. And I'll be presenting on that again tomorrow. And then I also, of course, with you, have a workshop on Wednesday, which is partnering with patients and talking about research co-design and implementing PPI into your research. Yeah.
And is it my understanding that you won something?
I did win the best poster for Postdocs. Yes.
Congratulations.
And a big surprise to me.
Amazing. That's great news. So we're going to jump into some of the topics that you've all been listening to over the last few days. So the conference has been going on for a few days, if we include all the pre-conference sessions. So we had the professional interest area days on Saturday. So should we start with those in terms of what you found interesting, in addition to kind of what you were all presenting, if there were kind of key takeaways from it. So we'll go around kind of in the same order. So Lillian, what was kind of the standout things that you saw on the kind of technology day? What do you want to share with everyone?
Yeah, the EDI, like the equity and equality, and that's really, that really like struck me about the biases that how underrepresented the populations that often are not included in the research, and how it might impact decision making, and how because we always talk about like evidence informed practice and how people policy are being made, but if it's only based on a small percentage of populations, it's so unfair, and there's so much needs to be done. So that really struck me, like the weird phenomenon.
I think there was a really great quote from Sayabaya to that, actually. I think it was, to paraphrase it was something like, the bias in your data set from recruiting participants leads to bias in your algorithms, and that leads to bias in your clinical decision making. And I think it really highlighted that even when we do try to recruit underserved groups, we actually end up with a biased sample of them as well. So there was a talk by Hiroko Dodge where she talked about they'd recruited, they'd actively tried to recruit African Americans into the study, but they found that the African Americans were less sad and less socially isolated than the rest of the sample. And they were like, that's probably not because that's the situation. It's probably that they got some very, very keen beans who really like research and that kind of thing. And actually, we're not getting a very diverse group of minority groups when we do recruit. So it's quite an interesting thing, because I think we've seen this all over this conference now, a lot of talk about diversity. But I thought it really highlighted that no matter if you're trying to get your sample to be diverse, are you actually getting a diverse sample at the end of the day? It's really interesting.
And I was also very inspired about that, like the assumption that people often made about because they can't afford the device and we cannot include them in the sample. And they talked about that there are other ways that you kind of find to be creative, like repurpose some of the older devices that people don't use, and like think about like if they have to work, and think about other ways like using like maybe phones and other like smart technology to help data collection.
That's really interesting. So I went to a different workshop to you guys, but the theme was very similar, and it keeps coming up. And I think actually across the conference, this aspect of diversity affects all aspects of research. So what we were talking about, so I actually started my conference on Friday. So I went to a social determinants of health workshop, and there we were talking very much about not taking, so when we're looking at risk factors, we know there's still lots of research to do, of course, looking at risk factors of dementia, thinking about how, what dose, that kind of thing. But we know enough now to know actually what's good for brain health, diet, exercise, these kinds of things. So we need to start working to kind of promote these health behaviours, but we have to take into account that where they're living, and try to really think about the communities that people are in, and try to remove barriers that mean that they can't do these things to reduce their dementia risk. And again and again, it kept coming up about the aspect of bringing in more diverse people, and what we need to do is start building communities of public health researchers, community groups, and really try to find out what needs to be done where people live to mean that they can then make decisions and more of an individual choice to do things to improve their health. But for that to happen, we need the diverse groups, and we need to have these conversations as well.
Yeah. Really interesting area that keeps getting built on now. It's really great to see.
It could turn out to be like quite not respectful in you trying to impose recommendations based on maybe very Western type of research. I'm thinking about like there's a project that we are doing on a smart TV at home that a lot of the program was created based on a very white populations. And when we took it to the nursing home, the care staff and the resident was saying that we don't want to watch this. This has no relevance to us. Yeah. So we end up having our patient partners to make new videos saying they need to be like talking about their language, like taking their cultural context into considerations.
That's a great example.
Yeah, really highlights the benefit of doing that co-design work.
Yes, yeah.
Definitely. And so the Alzheimer's Association are clearly very kind of invested in including people and kind of improving access. How easy do you think that is to translate to kind of Canada and the UK in terms of, is that as important to our funders? Is that essential, do you think? Do you kind of include these issues in your research?
I think it's becoming more important. You certainly need to add EDI statements into your grants now. And, the NIHR have got the Include campaign, that's what it's called. NIHR have got the Include campaign, which is about representing underserved populations in your research and trying to create like a framework of how you might be able to include them. And it starts from, the very top. You have to co-design with them, ask them, how would you like to be included in the research? What research is meaningful to you? And trying to highlight that kind of research that is useful for underserved groups. And it's important also to think about who is an underserved person, because I think it was highlighted really well yesterday that often when we think about being inclusive, we think about minority groups. But actually, it was mentioned at the Tech Day that it could be carers who just have to work and they just cannot get a person to an appointment because they can't leave their job. And so it's really thinking about, basically, I think we think a lot of the time about like retired white people who've got the privilege of being able to move around. What about someone who can't drive? What about someone who can't afford a car? So I think it is becoming more of interest, but I guess I don't know if researchers necessarily in the UK have that a framework that's very easy for them to adapt and try to include people, or have those lessons that have been taught to them yet. Yeah.
I think in Canada we are trying to follow the footsteps, but there's still a lot of work need to be done in the infrastructure to support. In Canada, we call it patient-oriented research. Yeah, so a lot of times the patients' partners cannot be co-investigators or lead of the research. Like you guys have the patient lead research. We don't have that, yeah. So there's still a lot of things need to be done to promote that. But it's really, really important work. And I think there's a lot of interest, and we have people living with dementia are very interested in co-leading research to be more actively involved in research,
Yeah. Great. And coming to Sarah-Naomi, what did you find out from the Reserve and Resilience Day that you wanted to share with us, or anything else from the Social Determinants of Health Day as well?
Yeah, so I actually wrote on my notes that I wanted to raise the issue of diversity, so we've already covered that. A very interesting session I went to around sex and gender issues in the PIA Day. And so the kind of background to that is that we know that women have got an increased risk of developing dementia above and beyond the fact that they survive, are more likely to survive into older age. And so there's lots of discussion around why is that? Is that to do with sex hormones? Is that to do with genetic factors and the downstream proteomics? Is it to do with the kind of social constructs, especially thinking about women who are in older age now? They had different educational opportunities, like a lack of educational opportunities. So it was a really interesting topic about that, but the two people who were leading the session turned it into a debate, and they concluded their remarks in song, which was very interesting. So Dr. Rachel Buckley ended in singing a song about estrogen to the tune of Yesterday by the Beatles, which was, I think there's a video of it somewhere on Twitter, and so it was really nice because it made the debate very lively, and it's definitely one that I'm going to remember. But there is obviously a serious undertone to the research, and it was really great to collaborate, to network and kind of bond over this very unique experience that we all saw.
Yeah, I've seen the video on Twitter, and it's definitely worth watching. It is amazing. Brilliant. And Ree, was there anything else from the Technology Day that you wanted to bring up and highlight?
I think there was a real highlight talk was Arlene Estelle's talk that she gave, and it was looking at kind of use of technology around cognition, really. So she had kind of different components that she's talking about. One of them was she has got some work where they've done some technology-led reminiscence therapy, which was really interesting, songs or videos that people enjoyed and things. And I learned so much from that. things like, general photos of a time period are actually really good, whereas personal photos can be quite confusing for a person with dementia. They might feel expected to remember something that they just don't remember. But if you put, a picture of Elvis up, they'll have a lot of things to say about that. And she said that basically when she'd started that Reminiscence research, she thought, this would probably be helpful to quality of life, that kind of thing, but it probably won't be that helpful to cognition. And I believe that she found that it actually did improve cognition, and at over 12 weeks it improved cognition again. So there's this kind of aspect, and I'm not, Lillian might correct me on this, but I think she kind of thought it was to do with that interaction they were also having with the care staff and care homes and things, that they were working with them more, speaking to them more, having more conversations with them, and that was improving their cognition. And she did this great part around maintaining cognition and how we might use prompts to do that and use technology to lead the prompts. So this is something that is very close to my heart. I'm very interested in it. It's the kind of idea around helping people maintain their instrumental activities of daily living rather than them beginning to make mistakes and someone taking it off them. So she used the example of someone mashing potatoes. She said that they did co-production research, and they asked this woman, what is it that you want to do? And she said, I want to be able to maintain making a Sunday dinner. And they said, that's probably too difficult to do for a research project, so we're gonna go with mashed potatoes. We're gonna make sure you can mash potatoes. And it was quite cool the way that she did it, because she put up pictures of the woman going through all the steps of mashing potatoes. She peeled the potatoes, she put the potatoes into a pot and poured boiling water in. She cooked them, drained them, and mashed them. And in the pictures, it looks like the woman can do that absolutely no problem. But in reality, when they were watching her do it, at one point she lost the pot lid, couldn't find the pot lid, couldn't figure out where it was, found another pot lid that wasn't correct and was too small for it, pulled out all of her saucepans to figure out what she should do. And eventually the researcher prompted her and said the pot lid is there, and she was able to maintain doing the task. And so what they were talking about was trying to, instead of a researcher being there, have a piece of technology that would say, oh, it's just there. And that might allow people to maintain that independence for longer. And I thought that was just a really, really interesting piece, because we see that with people with dementia. They might start to be unable to do something, and it might just be easier for a carer to do it for them. I've definitely spoken to my PPI contributors where they've said, he's not great at doing it, but I still want him to do it because it's important that he feels that he is contributing to the household in some way. So I just thought that was absolutely fabulous talk, to be honest. I got so much out of it. I'm going to stop gushing now.
I like what you said about that piece, that it was important to him. Like Arlene talked about, it's important to focusing on things, that the everyday things that matter to the person, right? Like there's a lot of stigma, stereotyping, and thinking about that people in long-term care, and it's the length of stay is short, then they don't think about they want to fund things that will improve or maintain the conditions. And it's not true that people get used to technology, and it can improve their quality of life and improve their condition, or at least maintain it. It's worth it. Yeah,
definitely.
And so to what extent do they kind of want to personalize tech? Because it feels like that's probably quite a specific example that will only help a small amount of people. So what's the kind of idea around that?
I can't remember what she said about that part. I was still on the mashed potatoes part, I think. So I'm not sure, Lillian might remember about that, but I think that they were kind of thinking about co-production with people with dementia to see where they would go with that kind of next step. But it was more that there is an opportunity that technology could address it, and we need to think about what is important to people with dementia. And this always comes up, especially in consensus reviews, Delphi consensus. Maintaining independence and being able to do things that matter to a person are the most important things for them. And the kind of way that we set things up don't really look at that. Do you know what I mean? So it's I think it's quite novel and interesting if we can get something that would help, but not sure.
And I think with the tech, there's a lot of opportunity to do that personalization work. Like, for example, like the circuit that Arlene does, that you can personalize the content, right? If it's a family videos, and it's photographs of the family, of the pet, or something like that. I went to one of the exhibition hall. It was so much fun. One of the vendor had a program. It's a very simple program that you can just go to the iPad and you can voice record like simple questions, like what is some of the things that I really enjoy in my life, and then they could turn into a kind of like a care plan, and that makes it really easy. It's that piece that you talked about, like helping people to have a relationship, when they talk about the reminiscence, then you get to know the person, and that's really key to person-centered care, right?
Yeah.
Oh, it sounds so interesting. The technology day just sounds great, and as do all of the pre-conference peers.
Pre-conference, it really is.
And did anyone have anything from the first official day of the conference that they wanted to talk about? Any kind of sessions that you went to that were kind of standouts or really interesting that you wanted to share?
I guess I went to one on, I'm not going to say this correctly, non-clementia, I think that's what it was called. But it was kind of, they had done some co-production work with patient groups around the term dementia or Alzheimer's disease. And I thought it was really interesting, actually, because they talked about how patients were very confused about terminology. They were confused about Alzheimer's. They thought that might be separate to dementia. Mild cognitive impairment, they felt that was a strange diagnosis to get because it doesn't seem that bad. It's only mild. And we've seen this come up in some of our PPI work as well. And actually, it's come up in a systematic review that I've got an undergraduate student presenting on in the dementia care session tomorrow about the impact of mild cognitive impairment, where they were just very confused by that term, but very worried about dementia. So in this session, they were talking about there's a lot of ways that we talk about Alzheimer's disease. We might talk about Alzheimer's disease as Alzheimer's disease, but we might also talk about it instead of saying the word dementia, people say Alzheimer's, or they say Alzheimer's, dementia and related disorders, which is very confusing for people. Or we talk about it in a pathology kind of sense. And people think that, if you've got MCI, that you're going to progress to Alzheimer's instead of dementia or any form of dementia that you might get. So they were talking about maybe changing that term and changing it to, I think it was like older adult neurocognitive disorders or something like that, and trying to co-produce with people to make sure it was less stigmatizing, that it was more understandable, that clinicians could explain what it was instead of always like falling back into that lump of Alzheimer's and Alzheimer's related disorders. So I thought that was actually quite interesting. I have like a caveat in where I think, if it is used in diagnosis, it probably will just become stigmatizing again later on, because I feel like that's what always ends up happening. But I certainly see that even when I talk to my parents, they really mix up the Alzheimer's and dementia thing, and they're like not sure what they're talking to me about and things like that. So I think raising more awareness around that kind of terminology is really important.
Really interesting, especially when the term Alzheimer's is used in branding for charities, conferences. Yes. It's kind of used very publicly, but it is a bit of a kind of, what is it? What does it mean? And even within us, we might all have a different way that we kind of use these terms and things. Yeah, that sounds fascinating. Sarah-Naomi, did you have any sessions you wanted to talk about?
So I went to a couple of the epidemiology sessions yesterday, and again they're kind of just building on our knowledge that so there are a couple of sessions looking at cardiovascular risk factors, but now in more diverse populations. So there's some really great work going on in Brazil, and there's some cohorts in more of the Latino countries. But just showing actually that the cardiovascular risk is increased anyway. So we, of course, would then expect the disparity in the outcome if there's going to be disparity in the exposure. So just emphasising the point that it's really important to look at these communities. And I feel like, the take-home message is definitely we know enough now, I think, about some things we can do, and we need to there's lots more research around the mechanisms, but we definitely need to make things happen a bit more easily for people to take risk reduction measures.
Mm-hmm. Yeah, great. And Lillian, was there anything from yesterday that you went to that you wanted to highlight? Or any posters at all?
Yesterday I actually went to the beach.
Lovely, that sounds like a great choice.
In the morning I did look at some of the poster, and there was one poster that from Australia that looked at dementia-friendly communities, and that was very interesting. Then she interviewed some of the community planner to see how what can be done to better support people living in a community. Yeah.
Was that the poster to do with dementia-friendly communities and government, where they were trying to get government to push them? I thought that was really interesting. Actually, I saw that one as well. Yeah.
I'm always interested in how as like the question that I asked on the Tech Day about how, as a scientist, how could we better work with policymakers and governments to make a biggest impact? Because I encounter a lot of difficulties that I want to include people that they don't have access to Wi-Fi. Like, it makes it very challenging to do. And even in the nursing home, that you can have like certain areas that have really good Wi-Fi, and across the next room that has no Wi-Fi, then that person could not put a telepresence robot there because there's no Wi-Fi.
It's such an important thing, isn't it? Because I think that we don't think about that very often, that a lot of people don't have access to Wi-Fi because it's such an instrument part of ours. And there is, like, in the UK, there's an Ofcom report that says that 40% of people over, I think it's 65, don't have a smartphone, so they couldn't possibly use it when we design these apps for smartphones and all this kind of thing. So it's really interesting because that is something that's a government push of free accessible Wi-Fi to everyone of at least a basic standard. I thought that was a really good question, and there wasn't really an answer for it, but I think it would be so interesting to have a session at something like AAIC about working with policymakers, because we do this at Newcastle University. We've got a policy academy, which I was part of, and you do 9 months of training of how to interact with policy.
So wonderful.
It was amazing. So either the government, the local community, the NHS, and they bring in professors and researchers who have worked with policy and have successfully implemented things in, and they all have different stories about how they did it, but kind of the main thing that I noticed coming out of those for medical research was the patient voice and getting the patients to advocate for you. So they I've gone off on a bit of a tangent, I'm very sorry, but they had Professor Roy Taylor talking about his diabetes work and his diabetes intervention, which reduces your, I think it's type 2 diabetes to a point actually where it's gone, you don't have it anymore. But it was very hard for them to push that through. And what he did was he wrote a book on it. He got patients to talk about it. They went into their doctors and they said, I could have this intervention, why are you not offering me this intervention? And now it is an intervention in the NHS because of that. So I think it would be great to see, people who have changed policy for dementia and hear their stories at a day like an Alzheimer's Association Day.
Policy Academy.
Yeah,
that's what we
Policy
need.
Academy. It's so cool, honestly. It's such a cool little thing that Newcastle University do. And you learn so much about like government structures, things that I would just never know, like how the UK government actually influence policy, how you can speak to them, the ways that you can address them and that kind of thing. And it will be, completely different internationally for different places, but it would be really, really cool to see.
That's so important. It feels like we need to be doing that work in parallel, doesn't it, alongside developing our work. So we talked a lot about this in the Social Determinants of Health workshop. And we were talking particularly, so one of the risk factors with the most evidence of risk reduction is hypertension. And we know enough now to know that we need to start doing more to reduce hypertension in the community. We have the medication for it, so why aren't we doing it? Why aren't we getting better? And I feel like that's a very clear example where actually we know what we need to do, but we need, as scientists, but then we need other people to help implement it. We need, the targets, we need the clinicians to even get that message. We need people, of course, then to hopefully take a bit of a responsibility in asking for that as well. But it can't happen, the science is there now, and so we need to build on that with other people to make it into practice.
Yeah, well said.
Brilliant. Well, that's all we have time for today. I think it's been really interesting that the same themes have basically come up across all days: equality, diversity, inclusion, and co-design being at kind of the centre of what we do. So it's really nice to see those themes kind of going throughout the whole conference. So as ever, you can find Twitter links and bios for today's guests on the Dementia Researcher website at dementiaresearcher.nih.ac.uk. So it's time to end today's podcast recording. I'd like to thank our guests, Dr. Lillian Hung, Dr. Ríona McArdle, and Dr. Sarah-Naomi James. And please remember to subscribe and come back tomorrow for more reflections from day 2 of the conference, and you'll find a massive amount of information on social media using the hashtag AAIC2022 or hashtag AAIC22. And you can also go to outs.org/AAIC for more information and potentially watch a 360 video version of this podcast on YouTube. Thank you, everyone.
Brought to you by dementiaresearcher.nih.ac.uk in association with Alzheimer's Research UK and Alzheimer's Society, supporting early career dementia researchers across the world.